This is Sg2 Perspectives, a weekly conversation between the Sg2 intelligence team and industry thought leaders about the biggest trends in healthcare. We are happy you joined us today. Enjoy the episode.
You're building new revenue streams when you offer something within integrative medicine because a lot of these services are self-pay. And what we're finding is that patients aren't willing to pay these out-of-pocket costs for these services.
Welcome to Sg2 Perspectives. I'm your host for today's episode, Jayme Zage. There's a growing invigoration around integrative medicine, and I wanted to explore what strategic planners really need to know about how they can convert consumer demand into a real viable component of their health system portfolio of services. I asked my colleague, Hailey Mulliner, to come and spend some time with me talking about that. She just completed a report on integrative medicine. And so welcome, Hailey. Thank you for taking some time with us.
Thanks for having me, Jayme.
There's a lot of different potential definitions of integrative medicine. Why don't we start by just laying out, from the context of your research, what's included?
When we're talking about integrative medicine at Sg2, we're talking about combining traditional medical care with complementary care. So typically evidence-based complementary care approaches to really treat the whole person. We went with integrative medicine specifically because we could have picked wellness, functional medicine, something else out there, but felt that integrative medicine encompasses all of those things. We're really talking about that traditional medical care, Western medicine in combination with some of those alternative complementary approaches to care as well.
Things like acupuncture, chiropractic, massage therapy, anything I'm missing in that top list?
Would even include nutritionists as well. Falls under traditional care, but even sometimes different behavioral health providers will also be pulled into this definition. Nutrition, acupuncture, chiropractor, massage therapist, those are what we're talking about.
These types of non-traditional therapies have been around for a long time. Why are more organizations looking at building these more integrative medicine programs now?
There has been increased interest from consumers. They're looking for something that provides more of a whole person approach to care. And we see a lot of direct-to-consumer companies pop up that are filling that gap. They're starting to take that patient volume away from health systems. And also, more importantly, they start to develop relationships with these patients at that ground level, at that front door for systems. Some of those direct-to-consumer competitors, you've got like Function Health and Parsley Health, just to throw a couple out there. The increased consumer interest, but also increased evidence that these are really beneficial in a couple of different ways and can provide that strong relationship building for a health system as well by providing patients what they're looking for in their care journey, but also just another additional layer to their care that has some cool beneficial outcomes for the patients too.
Well, certainly some of them help to reduce the reliance on pain medication and things like that as well, which can have some real positives for a number of patients. Is there any ROI on this? Are they reimbursed at all? What's the business model for these?
When I was writing my publication, got to get a little creative and broaden how you're thinking ROI. It's not just that traditional dollar revenue that you're getting back, but you're also building that patient loyalty. You're building that ROI in a couple different ways. It's not always that traditional look, but you're building new revenue streams when you offer something within integrative medicine because a lot of these services are self-pay. And what we're finding is that patients aren't willing to pay these out-of-pocket costs for these services. We found that in that Sg2 consumer survey. Patients who have high deductible health plans are more likely to be willing to spend this money. It's just another cash-based service that you can offer. So it's an alternative revenue stream in one way. Nutritionists or acupuncture patients are willing to pay cash upfront. There's also some cost avoidance aspect to it. You're saving money downstream as a system from seeing better chronic disease control. You might see fewer admissions, less reliance on that high-cost hospital care. Even feature a study in the publication where there was cash savings per inpatient admission when they saw someone that was considered one of their integrative health specialists. The loyalty aspect is a huge ROI for a system. It's hard to capture patient loyalty these days. Adding in some of these additional services helps with that loyalty and keeping patients engaged with your system specifically, which will reduce leakage down the line and also have patients think, they provided me these great services. I want to come back to that system next time they have something come up.
It's part of how we can create some stickiness with patient loyalty. What do these integrative medicine programs look like? Is there a common model you see?
There's a couple different models. Systems really have to try out what works best for them. But generally, the most common are three different approaches. One would be embedding some type of integrative medicine into a specific service line. So have a great case study in that publication on embedding some integrative medicine practitioners into a GI service line, whether that be embedding a nutritionist as a part of that care team within your GI service line. Or if you think of cancer, I think cancer is another great example. A lot of health systems have started to embed something like an acupuncturist within a cancer care team to help with some of that pain management, maybe even some of that nausea. So embedding within service lines, it's one way to build it out. Another model might be, and it's the second most common, is building it out within your primary care clinics, adding some of these practitioners within the primary care clinic and the primary care teams that you develop as well. And adding in maybe a nutritionist into your care teams at a primary care clinic to help with some of that chronic disease management. This is usually where it is more focused on chronic disease management within the primary care versus specific service lines or specific disease models. And then third, less common, but it is always an option, is building a standalone or a spin-off model. So separate brands even coming from a health system that offer that membership base. Sometimes they're fully digital. Sometimes they have that clinic space, and it's frequently seen as self-pay, but some sort of spin-off from the health system that captures more variety in the integrative health offerings and usually have some type of membership or cash-based model. Those ones lead more into creating an alternative revenue service. That cash-based model, you're getting an alternative cash flow for your system.
How many organizations today have a formal integrated health program?
I wish I did know the answer. We're seeing them pop up more and more. What is less common is having a whole arm dedicated to integrative health. You and I both live out in California. You see that more commonly out here on the West Coast. It's very geographically driven still at the time. Is this something that the patient cohorts you're seeing are really craving, or is it not? Less common in certain regions of the country. Last year, I've had health systems across the whole United States ask me about building out an integrative health offering and what that looks like. There is an uptick in interest not only from a patient standpoint, but also from health systems. And I wouldn't be surprised if at this point, most health systems have tried out or are going to try out some sort of integrative health model, whether it be smaller scale and just embedding an acupuncturist in that cancer service line, taking that smaller step than rather biting off that big chunk of let's build off this brand that is attached to us that has a larger offering.
When we talk about this, you get questions weekly. What's the most common question you're getting around integrated health?
The most common is, what does it look like within a health system? But also, what does it look like from a disruptor standpoint? There's increased understanding that health systems are not only competing with each other for these types of patients or this type of relationship building aspect, they're competing with disruptors as well. A lot of questions of not only what do disruptors in this space look like, but what do disruptors in our market specifically look like? Who's out there? Who are we competing with? How do you start to build something like that out? I always suggest take that small bite first, integrating into service lines as an initial approach to see what is the patient interest. But I also have been pointing more to our consumer survey results. We have a lot of great info in those survey results that can be done localized at a state level. That guide, hey, what are our patients in our state looking for? Are they interested in some of these services? Something that is called out in the publication, physical therapists are included in these integrative health models. What came out of the consumer survey is that the physical therapists are one of the most trusted healthcare providers today, and points back to that relationship building. If you have patients that have a strong relationship with their physical therapist tied to your system, they're probably more likely to continue to be engaged with your system too.
You actually get a devoted half an hour with that provider when you have physical therapy. So you get some time to get to know each other. They get to know you. That may be part of it. Our short time that we have with patients in the doctor's office. As we think about the long-term components and about our strategic audience here, what's that long-term strategy?
If you haven't thought about it as a system or it's not a conversation that's come up, maybe bring that conversation up would be step one. But if you've already started to think about it, getting that baseline information of where is our market at with it? What is the patient interest? How do your providers feel about it? Because they're going to be working closely with these alternative providers as well. What is your culture as a system to bringing in some of these integrative medicine offerings? Doing a ground assessment of what are our patients interested within our market? How do our providers feel about it? What does it look like in terms of what's already offered in our market, whether it be disruptors or other health systems? If you have that patient interest, if your providers are also interested in bringing some of this in, it's a good time to think about what would be the best fit for us within a system. Starting with that bite-sized chunk, maybe you embed it in a service line. Maybe you have a provider who wants to be the leader on this. They're really interested in integrative medicine and they have something they really believe in. Maybe it's acupuncture in even an ortho clinic for pain. So you have someone within your ortho clinic who's a current provider and they're like, I want to pull this into my clinic. That's a great place to start. If you see success with it there, can we start to build this out as a broader offering for our system? Also being clear up front around as a system, what are our strategic goals of what does success look like in building a program like this out? Are we looking for that pain reduction or maybe embedded in behavioral health? Are we looking for anxiety reduction in our patients? What are you looking at for your ROI within your system? ROI in this situation can be a little bit flexible. How do you define that within your system? And what do you want those end goals to look like that work for you as a system, but also your patients and your providers too?
You mentioned earlier whether it's a value-based care play or maybe it's more of a consumer engagement and creating that customer loyalty, that patient loyalty perspective. That could be part of your strategic why. Hailey, this is a great way to end our conversation. I appreciate you taking some time to just share some of the basic insights, and I hope our clients will get a chance to see your report. Take a look for it on our website. Thank you for being with us today, and thank you to our listeners for joining me on Sg2 Perspectives. Thanks for listening to this episode of Sg2 Perspectives. Please don't hesitate to reach out to Sg2 if you have questions or suggestions for future episodes.